I was part of this program that they had for young mothers, and a friend of mine, she recently passed away. She was forced to go to a different high school for young moms, but I was allowed to stay there, and I think it was my sister's doing. All that to say, my sister really did a lot for me. Familial-wise, she was the only one, but she, at the time, was living in Winnipeg. She now lives in the States, so she had to go back home. And again, not blaming anyone, but I was literally alone. And that was just hard because you're like trying to reach out to people and they see, I wasn't supposed to cry, y'all. What's going on?
I'll start off by introducing myself and telling you like who I am, what Freedom Tree is all about, and why I'm here. So I run a non-profit organization called Freedom Tree, and we focus on reducing the rates of maternal and infant mortality in West Africa. Specifically, Sierra Leone right now is where we're focused, and we've seen huge differences just in the work that we do in communities and villages. And I would encourage you to check out our website or social media site to find out a little bit more about how we do, what we do. And in my journey, I'm very passionate about maternal health, and not just like, in this country, we don't necessarily have an issue with maternal mortality per se, although it is of interest to note that the United States has the highest rate of maternal mortality in the world of any developed nation. Of any developed nation, and it's amongst Black women. And what we found, both in our work that we do in Sierra Leone and also through research in the US, is maternal outcomes are worse when you're a woman of color. And a lot of people don't know this, and I'm really interested in starting this, well, not starting the dialogue, but fanning the flames of the dialogue here, even in Canada and in Calgary, and highlighting the impact of racism on birth outcomes. So in our work in Sierra Leone, there's a saying that I say is like, it really matters how you're born. It matters, how you come into the world. It matters what your birth experience is. It matters what happens to mom, in that process, and how is she treated, and, those types of things. And, even in Sierra Leone, where it's homogenous in terms of the culture or in terms of the, color, you still find a little bit of prejudice, like depending on the socioeconomic status of the woman when she goes in to go give birth, which can have very negative outcomes on birth, like if she doesn't have enough money to bribe the nurses or pay for an ambulance or things like that. It can literally mean death in many ways. And then we're also beginning to delve into this issue with First Nations women as well, because they're also suffer greatly in this. And so I just wanted to gather a group of women, and this is where I'm thankful to Christy. Christy came in to help with this. A group of women who are willing to maybe share their stories. And I don't know anything about you. I don't know your stories or your outcome, but it's just, finding out, do you think color has played, an impact? Has it had an impact in how you were treated when you were given birth? And if so, in what way? What can we do about it? What can we do about it in Alberta? Like, what can maybe the government or people do about it? What are those things? And highlighting those issues, and I think probably bringing them to light and talking about them.
So I was a teen mom. I got pregnant with my eldest son. I was in grade 12, and I was at a Catholic high school, and I was apparently the first pregnant person at a Catholic school in Calgary. Thankfully, when I was having birth, my sister, much like you shared, she's a nurse. She has always been a nurse. At that time, she was a maternal nurse, though, so she was there with me, and she helped me through that process, because when I got there, the nurses were just like, "Are you sure you're supposed to be here? Like, where's your parents?" Like, because I just showed up, and she wasn't there yet, so they were just confused, and it wasn't very warm, like, "Come in, we have a bed for you, you're going into labor." It was very cold until she arrived, and she just kind of took over. And then I remember having calls like from social workers, and just like those eyes, like, you're not doing anything right. And my sister wasn't there, and I was just like, I have never had a baby before, and I'm just trying to finish my exams, and I don't know. And it's just like the ridicule. And then the church was just like, what is this? And there was a rule, like I wasn't allowed to bring him to church because he was, what's it called? Wedlock. He was born out of wedlock.
Born out of wedlock, yeah.
So there's that. And then trying to baptize him was another thing. And silly Juliet, fast forward, I'm looking at my son playing, and he's just really alone, and I'm just like, I feel like I'm feeling his heart, and I feel like maybe it's God or higher power, I don't know, telling me that I need to have another child. And I'm just like, what? Why would I want to do this again? You know, but I went back into the fire with their father, and I had his brother. That experience was absolutely, completely insane. I almost died. I had a serious medical condition, and I was pretty much in the hospital for 4 months of that pregnancy. And this is where I think the work that Family Matters does and the work for Black women is so important. I was put on the ward where people go to die, in the last room, go all the way down, last room in the corner. There was multiple days I didn't get fed. Multiple days. I had, it's ironic because I wasn't fed, but at any given minute of the day, to not even get into too much details, I had stuff that if you look in my eyes, you can kind of see what I was going through. Mm-hmm. So 4 o'clock in the morning, 12 o'clock at noon, doesn't matter. I could be fast asleep. Some random specialist who flew in from Sri Lanka or wherever, because I had something that nobody had that was living. So I was this special case. And then when I did reach out for help, it's just like, well, look at you, you're driving a truck, you're okay. And not seeing all the things that were behind that, or where that truck came from, or where this supposed money was going. And so I think for people of color, women of color having babies, there's so much work to be done. Just having this baseline understanding of where we're coming from, or even how the circumstances happened for us to have the child, you know. So those are a bit of my experiences.
My prenatal experience was quite nice. I actually had a really nice pregnancy. There was some reluctance around because I got pregnant at 21, you know, so, everyone always has something to say about something when the baby comes, and it's everyone forgets all the not so nice things that were said, right? But it was more after I had the baby. My postpartum was quite difficult because I did not have the supports that I really needed. And I think of myself back then to now, and I feel like there's that youthfulness in me that, that youthfulness could push through anything, right? But I feel like if I were to go through the same thing now, I don't think I'd be able to handle it, And it's that same thing, I remember having, I probably should have spoke to someone a bit further about what I was feeling, and I was feeling those postpartum scary feelings, and I never admitted that to anybody. And then I look years now, especially now, getting more into mental health and all that, and going, well, why didn't I? Because I wasn't helping anyone. I was just hurting myself. It was just it was a hard time. So of course I could admit what I was perceiving as weakness, right? And especially in the Black community, that's a thing too, right? Oh, what do you mean you're sad? You have a house, you have a car, kids healthy. What do you mean, And but I think back now, yeah, I was kind of asking for help, but I don't think I was using the right language. I don't think I was being as direct as I could have been to be I need the help. I remember feeling I'm like, can you die from lack of sleep? I think I looked that up because I thought I might die. I was practically hallucinating. I was so tired, And the one person that could help me, my mother, there was just a bit of, and I won't get into detail, but there was a bit of resistance of having, because that's tradition. My parents we're Gunyan, so it's tradition. Mom comes, she helps with the baby, but there was a lot of resistance there, so she felt like she couldn't really come. So I was really on my own there. I'm so grateful though, because, you know, whatever it was, you know, call it your higher power, call it whatever, help me push that through. And then you get through those first few months and you're like, you know, I got the hang of this is gonna be okay. And your baby starts smiling and laughing at you and stuff. And, you know, like, I mean, from the get-go, when I had my son, I was just like, what did I do without you all this time, you know? Right? And then you're like, it's really hard to picture my life before him. And I'm thankful. I feel like having him and having that light is what helped keep me light throughout. Otherwise, I don't know where I'd be at right now.
For my story, I got pregnant a little later in life. I was very heavily involved in the church and volunteered greatly with the missions organization. So it was like the first time I've ever been with anyone, and it was like 30, like it was really late in life type thing. But it turned out not to be so great, because he turned out he wanted me to terminate the pregnancy right away when we found out and stuff. And I did, because at the time I was heavily involved in church, and I was even supposed to lead a mission team to Zambia and stuff, and I was a leader of the youth group and stuff. It was like, oh my gosh, like when they find out that I'm pregnant, I'm done for. It's all over. And yeah, so I did make 2 appointments to terminate my pregnancy, and I couldn't go through with it. I just couldn't do it. And when I finally told the dad that, no, I can't do it, then he says, I can't be there. So just left me and stuff. And lucky for me that I did have love and support around me. So that really was really good. The support of my sister in particular too. But the heartbreak of like my child's father leaving me and stuff, and I had all these dreams like from one teenager, you know, I'm gonna get married and have my kids. I want to be a perfect evangelical mommy and stuff and homeschool, like that, all those dreams. So I was just miserable during my pregnancy. Health-wise, it was healthy, but just mood-wise, like depression, was very rapid. I wasn't really excited, but it hit me till the last month of my pregnancy. It's like, then that's when it just hit me, like, I'm gonna have a baby, and got really excited about it and stuff. And then when she was born, it was like, I like that. It's like a weight lifted off. My sister was a huge help. Like even little things like, you have first time mom with this little newborn. My sister bathed my child. Like was the first to bathe my child. Fast forward 2021 when my sister's turn, and she had her baby. But guess what? There's a pandemic. So my sister lived in the UK at the time. She had she was having her baby. She had an awful experience, like the racism was blatant there, like just the way she was treated in the hospitals in the UK and stuff. And it hit me hard because my sister was such a great support for me when I had my child, and I couldn't fly there. I couldn't be there for her. I remember FaceTiming her and what she gone through and stuff like that, and just feeling so like that guilt and sadness that I couldn't go and stuff. So yeah, and it was hard. She made it through. She made it through and things like that. But I always say like, oh my gosh, I owe you like the world for how you've helped me. But it felt bad because I couldn't it wasn't reciprocal.
I like to say like I almost died twice. Once physically, once could have been due to mentally. So it wasn't until about 20 years later now that I'm only talking about having an abortion, because I was pregnant at 19, and when I hear these stories, I'm thinking, this is exactly what I was trying to avoid. I was scared. I can't even explain the type of fear. There was no one I could speak to. I never realized how much it impacted me until years later, because I too had kids later in life than most people, and I have 3 now. And when I remember struggling to get pregnant, and I automatically went to, I'm being punished. I took away a life, that was really heavy. It was really heavy on me. I blamed myself for a long time, and I'm like, this is why we're not getting pregnant. Fast forward, eventually I did have my first, and I think the The most struggles came after my second and my third. I had a C-section, and it was, they say what, like 99% or something. I don't know the actual stat, but it's a very low stat, 1 or 2 that have complications or something like that. So anyway, I went into it, and it was a couple weeks later that I basically was hemorrhaging at home. And so I was bleeding out while I was trying to feed this newborn. At this point, we were putting towels under me because I was bleeding out. And like when I say how much you have to advocate for yourself, and then if you can't, having someone else, it's so important. So finally, I was able to get someone to call the ambulance, and was in the emergency for I think the entire night, like several hours, like 6-7 hours. They couldn't tell me what was wrong. When I finally got admitted, it was very, when you guys say abrupt, curt, that was what I was met with the nurses, except for one, and she was the only other colored nurse. And so she didn't come and help and like change me and roll me. I would have had bed sores. Like, she was just really attentive and more, not just like on a clinical level, right? So it was, the word that comes to mind is nurture. So much so that fast forward, I came back to give her a gift and to just let her know, because I saw she wasn't treated well by staff. I wanted her to know how much she had helped me and how much I appreciate, what she's done. And it was just so genuine. And I remember, in comparison, I had some other nurses who would dig in my garbage to take out old booties to give me to wear again, because she didn't want to get new ones. Like, this is the kind of treatment that I had. Also, I also had a friend's mother who was a nurse who happened to be around at the time, and she would come in and she would ask, "Did they do this, Christy? Did they do this?" And I said no. She would get fired up, and then she would go and make sure it got done. So again, she was advocating for me. If she wasn't there, who knows?
That process was interesting because I didn't plan on having number 3. And to my husband's delight and my mother-in-law's delight, it was a boy. So giving birth to him was difficult because I had 2 toddlers at home. By the time he was born, I had 3 under 3. And my mother-in-law came from Ghana to support. When she came, I realized it wasn't much of a support. And I felt very much under the watch of, what am I doing? How am I doing it? Fortunate for me, I did have a mom. I did have a really good support in the birthing room with me. I had my aunt, who was a maternity nurse for years and well respected in the hospital. So when I came to the hospital, it was just, "Oh, you're such and such's niece." It was the postpartum piece that really stuck with me, because I didn't feel like I had a voice to ask for help. And yet there was a lot of expectations on what I needed to do. And I think my mother, although she was here in the city, she just didn't know how to support, because she knew that my husband's mother was there, and she would come and help me wash clothes every so often, but for the most part, I was really pressured to make sure I had a healthy baby. He was tiny when he was born, and so my husband kind of looked in disgust as, "Oh, he's really tiny. You gotta fix this. He's too small." And so I was very well endowed, and the poor thing couldn't manage the breast. So it was hard to get him to latch on and to get him to feed. And then I had the watching eye over me to see that. And then again, had 2 toddlers, so I had one that was potty training and then one that was still in diapers, and so I still had that process of having to help the older ones kind of gain their independence, but they still needed mom. I was just fearful of asking for the help. Although I work in the area, I'm a social worker, and I've always known of resources that are available and supports that are available. I just didn't want that to be my story, really
So I really focused hard on trying to push through those yucky feelings of I don't even know what I'm doing. Do I really know? Am I really gonna get him fatten him up? Am I really fit in the role of a mom and a wife? Am I really balancing it? So I really sat in my head for a long time. Yeah.